6% of people who die of lung cancer don't die because of smoking or AQI. They die because of indoor air quality.
The numbers which you spoke about are quite conservative. It is 7.9 million deaths in 2023.
Today, I'm sitting with Mr. Shailesh Nigam, a distinguished HVAC, yani ki heating, ventilation and air conditioning professional, and the COO of AAF International, a 103-year-old pioneer in clean air solutions and part of the Daikin Group. Mr. Nigam is responsible for overseeing the company's operations across India, the Middle East, Africa, and the CIS regions. Since he is spearheading a campaign promoting air filtration, let's ask him why indoor air is vital for health and wellness.
So 72 years of his life is spent indoors, and that is why it becomes very important to take care of indoor air. A normal healthy person takes around 20,000 breaths and breathes around 2,200 gallons of air. People don't question the quality of air because they don't see air. The particles which are invisible, which we are continuously inhaling, reaches to our bloodstream. So every cell of your body is getting impacted because of the pollution.
Indoor air quality को क्या चीज सबसे ज़्यादा impact करती है and what are these different things?
There are two major factors which
अगर हम अपना एनवायरनमेंट इतना प्रोटेक्ट कर देंगे कि घर में भी एयर प्योरीफायर है, बाहर जा रहे हैं तो एसी एनवायरनमेंट में बैठ रहे हैं, तो ऐसा नहीं होगा कि हम जहाँ ट्रैवल करेंगे बस उसी दिन बीमार हो जाएंगे.
See, some customers like that only. They said, what is the ROI if we use good quality filters? You are drinking dirty water, I am bringing you packaged water and you are saying what is the ROI, why I should buy this bottle?
क्या स्टैंडर्ड्स होते हैं जो मेंटेन करने पड़ते हैं स्पेशली फॉर हॉस्पिटल्स?
You know, ideal situation would be that hospital display the IAQ
Air
levels
quality,
in different areas. It is really, heartbreaking if he's in the hospital getting his tumor treated, but comes out with lung infection. I have challenged people, please go and check your air handlers. 99% you will not find filters clean and you will not like to sit in the same place again. I have seen air handlers without filters also.
Wow.
Putting bed sheet or sari or jute bag also, certain cases.
When we reach home, we feel safe. And for me to know that I'm not safe in my own house because of the air that I'm breathing, how do I control this?
You have hit the bullseye. We wanted to be acclimatized.
How was your journey?
We came yesterday.
You came yesterday. Wow. Hi Shailesh.
Hi Chhavi.
Welcome to Candid Confessions with Chhavi.
Thank you.
So I just want to tell my audience today कि हम लोग अक्सर AQI के बारे में बात करते हैं, लेकिन इंडोर एयर क्वालिटी के बारे में हम सोचते ही नहीं है, क्योंकि घर एक ऐसा एनवायरनमेंट होता है जहाँ हम हमेशा सेफ ही फील करते हैं, तो आपसे मुझे पता चला, इनफैक्ट मैंने आपसे बात करने के बाद काफ़ी उसके बारे में रिसर्च भी की और कुछ स्टेटिस्टिक्स मैंने पढ़े जो सुन के मेरे होश उड़ गए. That according to WHO, 3.2 million people die on a yearly basis because of indoor air quality. So ये indoor air quality होती क्या है? एक तो मुझे ये बताइए आप, just to clarify.
First of all, thanks a lot, Chhavi, and I would sincerely like to appreciate your grit and determination with which you fought your cancer. You're a cancer survivor, and normally somebody gets to know he or she has cancer, it is like a death sentence. But you faced that trauma, you have gone through that struggle of treatment, and you came out like a winner. You have set an example for the people that there is nothing to be afraid of. Rather, face it. It is early detection and it can be recovered. So
thank you so much.
You have really set an example. Coming to your question on AQI and IAQ. AQI are the measurement parameters about the air quality. It is air quality index when we talk about the pollution level, and mostly it is measured outside. IAQ is indoor air quality. So again, it is a very important topic where you have started this conversation, because people don't question the quality of air because they don't see air.
Correct.
Air is visible when there is pollution which has reached to a level where it is visible.
Exactly. In fact, आज सुबह जैसे मैं अपनी विंडो के बाहर बालकनी से देख रही थी, तो मुझे नॉर्मली एयरपोर्ट नज़र आता है. आज नहीं नज़र आ रहा था. सो मैंने गूगल किया कि आज का AQI क्या है. इट वॉज 161 और कुछ दिन पहले वो 60 था. सो वो एक चीज़ है जो हमें दिख जाती है कि अच्छा हाँ अभी फ्लाइट्स टेक ऑफ हो रही हैं, नहीं दिख रहा है एयरपोर्ट, नहीं दिख रहा है, लाइट्स नहीं दिख रही है, मगर घर पे कुछ समझ ही नहीं आता.
Now, can you imagine having AQI in single digit?
वाह, होता है ऐसा?
Of course, you go to Western countries, you land in Europe, any country, you go to America, the AQI is in single digits. You can see miles.
आई थिंक
So clean and
इट्स लाइक
clear.
जैसे आपने
So
कैंसर की भी बात की ना, तो हम जब कोई प्रॉब्लम होती है ना तब हम उस चीज़ को आइडेंटिफाई करते हैं, उससे पहले हम आइडेंटिफाई ही नहीं करते हैं. तो जब हमारा AQI ट्रिपल डिजिट में पहुंचा तब तो हमने आइडेंटिफाई करना शुरू किया कि ये भी
exactly.
कोई चीज़ है.
In fact, AQI also, when Barack Obama visited first time, then only it became, common term where people started talking about it.
करेक्ट.
The US president came, and
Correct.
then only, and it was the time when 26 January was the time when it was more visible. And this is the time when we talk about pollution. So it is kind of seasonal, and it is actually not seasonal. So coming back to what is IAQ, why it is important? Because as per the studies, we spend 90% of our time indoors. So if somebody is living a life of say 80 years, so 72 years of his life is spent indoors. And that is why it becomes very important to take care of indoor air. Usually means I'll go to that part where, why we have to care for air. We have been hearing our body is made of 70% of water. So water should be good quality. Our childhood days, I remember we used to put hand anywhere and any tap public
Correct.
water outlets, and we will drink that.
जी.
Today we can't even think of it. For last 25-30 years, we don't see any house without RO water purifier. So we are very mindful when we are eating or drinking something.
करेक्ट.
We go to the brand, packaging, expiry, and to the level of checking the content, cholesterol, carbohydrates, energy, sugar, all those things. How much we eat during the day? 3 times, 4 times, maybe 2.5 to 3 kg. How much we drink? Water, tea, coffee, juice, alcohol. It will be mostly coming to maybe 3-4 liters.
Yeah.
But do you know how much we breathe?
Breathe.
A normal healthy person takes 20,000 breath, around 20,000 breath, and breathes around 2,200 gallons of air.
Wow.
Now 2,200 gallons, if I put it in perspective, it is equal to the size of a normal size swimming pool.
Whoa.
So in 24 hours, you're breathing air, that volume of air which is getting inside your body. From the air, you're taking oxygen. Now, this air, if it is not pure, if it is not clean, if it is having contaminants, those contaminants are entering your body which are not visible. Because what AQI we are talking about, where it is creating a haze or pollution, you said 160. I was in Gurgaon, Delhi NCR for 10 years during 2010 to 2020. And when, AQI used to be around 140, 150, we used to say, now it is outdoor is good.
Right.
And I'm saying single digit. So single digit, we can't even think of.
Think of, yeah. But this
Everywhere.
figure that you gave of what, 20,000
20,000
breaths a day,
A
and
day.
the amount of oxygen we are consuming and not thinking about the quality of it makes me think like अगर आप पैसे देके कोई चीज़ खरीद रहे हो तो आप माइंडफुली खरीदोगे उसको, कि पानी भी आज आप खरीद रहे हो और आप खाना भी खरीद रहे हो, लेकिन हवा आपको फ्री मिल रही है तो जैसी मिल रही है चलेगी.
Right.
बट टेल मी, ये जो इंडोर एयर क्वालिटी है, चलो आउटडोर मुझे समझ में आ रहा है कि ट्रैफिक है, पोल्यूशन है, हम लोग क्रैकर्स वगैरह बर्स्ट करते हैं, कंस्ट्रक्शन होती है, बहुत सारी चीज़ें हैं जो उसको अफेक्ट करती हैं, लेकिन इंडोर एयर क्वालिटी को क्या चीज़ सबसे ज़्यादा इम्पैक्ट करती है, एंड व्हाट आर दीज डिफरेंट थिंग्स?
See, there are two major factors which impacts indoor air quality. One is that outdoor. So if outdoor is polluted, then you're getting some amount of fresh air
through the
from
ventilation,
outside.
right?
So through the vents or through the door slits, window frames and all, some air is always coming inside. So the more it is polluted outside, more it will come indoor. So that is external factor which is impacting your indoor air quality.
Okay.
But in indoors also, your fabric of your furniture, your wall paints, your furniture finishing, varnish and all, everything, they are emitting VOCs. VOCs is volatile organic compounds.
Okay.
So all these paints and fabric, these are all having those VOCs, which are always there in the air.
Okay.
Then we come indoors from outside, we are carrying certain dust. The lint is always there in our clothes, hair, then skin cells, which are always, getting dropped. So this is always there. I'm talking to you. There is certain air which is coming out and getting dissolved in this air.
Right.
Certain contaminants which are always coming out when we are talking. Somebody is sneezing, it is
Staying in the
6-7 times.
Right.
Then normal talking. Somebody is exercising. So this all adds to your indoor air
तो
quality.
ये सारा इंडोर ये जो सब कलेक्ट हो रहा है ये बाहर नहीं जाता है जब हम खिड़कियां खोलते हैं बालकनीज खोलते हैं doesn't it like
बाहर
go out and get
बाहर
refreshed
जाएगा तो बाहर से तो
और ही
अगर
खराब अंदर आ रहा है राइट
पोल्यूशन है बाहर तो वो और
so
अंदर
that is not
आएगा.
an option तो
Right.
इसको क्लीन कैसे करना होता है फिर
तो for that only you need to have proper air purifiers.
okay
Because what we do when we are cleaning the air, we make the air circulate through the filter so that contaminants or pollutants get trapped on that filter and then air keeps getting clean continuously.
तो ये जब एयर प्यूरिफायर हम लोग यूज करते हैं तो क्या खिड़की दरवाजे बंद कर देने चाहिए
Ideally, yes.
okay
Because
खोलेंगे तो then again the filter
yes,
is
when you
working
are
over
keeping
time
it open, then more amount of outdoor air is entering in the system.
राइट बट
So-
ये जो इंडोर एयर क्वालिटी है ये तो हमने घर की बात की ठीक है घर का हम फिर भी थोड़ा उसको कंट्रोल कर सकते हैं हमारे हाथ में लेकिन जब हम बीमार पड़ते हैं और हॉस्पिटल जाते हैं तो हाउ इज द इंडोर एयर क्वालिटी मेंटेन्ड ओवर देयर इट मेक्स मी थिंक
It becomes more critical when we are talking of healthcare facilities. So there are standards laid out by the organizations like American Society of Heating and Refrigeration Engineers. It is there. ASHRAE we call it short form. Indian body of the same is ISHRAE, Indian Society. Then there is NABH, which sets the standards and guidelines what should be the air quality inside a healthcare facility.
अच्छा
Okay. So in hospital within the same healthcare facility, you have areas which require different kind of IAQ.
लाइक हाउ what kind of areas
So starting with OPD, outpatient department,
okay
general wards. These are the places where visitors are common. Even every patient goes
हाँ
there.
and in and out is
In
happening
and out is there.
constantly.
Frequency of visitors is high. So those are the places where filtration levels are maintained at a sort of generic, I would say.
okay
So we use filters which are non-expensive and with which are capturing higher size of particles and efficiency up to 80-90%.
okay
When we go to critical care like cancer wards
right
or critical surgeries, neurosurgery or heart surgeries are there.
okay
Isolation wards are there. There you need ultra clean environments because the patient, especially if we talk about cancer patient, while going through the treatment, they are immunocompromised.
right
Their immunity level is very low.
yeah risk of infection really goes up
Risk of infection is very high and very small fungal infection on the wall. Maybe a healthy person would not even notice that. But if a cancer patient is there and he is exposed to this kind of environment, his treatment will will become complex. The outcome of the treatment will be different. So it becomes very important to maintain those kind of ultra clean environment for where the special care is required for the patients. So there are laid out standards for designing the hospital. Certain areas we keep at positive pressure so that the area remains under pressure, so no contaminants from outside enter that area.
okay
Certain spaces we keep at negative pressure means pressure inside that area is less than outside. So only outside air will enter inside because there is certain infection, certain treatment is happening or patients are there with the infection which should not come out. And those areas in the air conditioning systems are isolated.
Okay.
The air from this area to that area or to general ward should not
interchange नहीं
mix.
होगी. Okay, so whatever is inside, if there is an infection inside, it stays there, and whatever is outside stays outside.
Exactly.
बाहर का infection,
So
मतलब अंदर की बात बाहर ना जाए,
yes.
बाहर की बात अंदर ना
So
आए.
basically the air from different areas should not get mixed.
Correct.
So you must have heard of term HAI,
HAI.
hospital acquired infection.
हाँ, right.
So it is really heartbreaking if a person is having treatment, he's in the hospital getting his tumor treated, but comes out with some lung infection. So if the systems are designed properly, it is installed properly, and if it is not operated and maintained well, then there are possibilities of having cross infections or not having those desired IAQs in those areas.
So tell me what happens जब ICU में जब अलग-अलग पेशेंट्स होते हैं, अलग-अलग सर्जरीज करके जो आए हैं, तो उनका तो रिस्क ऑफ इन्फेक्शन अलग-अलग होता होगा. तो वहाँ एक कमरे में इन सारे लोगों को साथ में कैसे सेफगार्ड किया जाता है?
It is always the recirculation of the air.
Okay.
They collect the air in such a way that it does not circulate within the area
Okay.
also.
Okay.
So I'll just give you the example of operation theater, how operation theaters are designed. If you you have an operation table, and on top you will see there is sort of grill type of arrangement. So the fresh air comes down from there and it travels in straight line vertically down, and then it is picked up from the bottom.
Okay.
So the contaminants, if you pick it up from the top only, then it is rotating or circulating in the entire room.
Oh.
Then chances of contamination spread is high. So they collect the contaminated air from the bottom, so it follows that path. So there is no circulation of the contaminated air in this area.
Okay.
And then it goes back to the filter where it is treated. And those areas, like I said, in general ward, in OPD, we use very inexpensive filters, but the ones which we use here, during COVID, you would have heard a term HEPA.
Yeah.
Many people got familiar with this term. HEPA actually stands for high efficiency particulate air. So where we need these very clean environment, we use HEPA filters.
Okay.
So again, I'll give you the example of COVID. The virus size was 0.1. If we say PM 0.1, so PM is that particulate matter. It is the terminology to assess the size of the particle. So we say PM 10, PM 2.5, PM 1. So this is PM 0.1. Now capability of HEPA filter is it can capture the particles as small as 0.3 micron.
Achha.
Up to the efficiency of 99.9997%.
Wow. Okay.
So it will allow only 3 particles out of 10,000 to pass through it. So that is the level of cleanliness is maintained in those critical areas.
तो ये कोई स्टैंडर्ड्स जिनकी आप बात कर रहे थे, ये क्या स्टैंडर्ड्स होते हैं जो मेंटेन करने पड़ते हैं, स्पेशली फॉर हॉस्पिटल्स? Are there any guidelines? Is there anybody who's keeping a tab on them?
This is what I said. NABH sets the guidelines.
तो ये कैसे, मतलब कोई सरप्राइज चेक्स होते हैं, कोई क्या होता है, वो एग्जैक्ट प्रोसीजर क्या होता है?
Yes, there are audits which happen time to time.
Okay.
I'm not sure how effective it is, but yes, audits happen time to time to ensure that that sanctity of the area is maintained.
Because I was thinking that as a patient, जब आपको कुछ इस तरह की कोई बीमारी होती है जिसके लिए आपको लॉन्ग टर्म हॉस्पिटल जाना पड़ता है, तो आप सिर्फ ये देखते हैं कि वहाँ का डॉक्टर कौन है, कि मुझे ट्रीट कौन करेगा. इतना तो हम ड्यू डिलिजेंस नहीं करते हैं कि हॉस्पिटल इज फॉलोइंग द पैरामीटर्स, गाइडलाइंस और नॉट.
You have hit the bullseye. Criteria for any person to go to hospital there are only two ways. One is that emergency situation where you don't think of anything, you
Anything.
just
Nearest
look
कौन सा
by
है, yeah.
nearest hospital. Second is when some scheduled treatment is there. Then first thing is that you try to talk to the friends, family, relatives and get the opinion who is a better doctor
Correct.
or the brand of the hospital. So these are the majorly two criterias based on which you decide the hospital. Recently, I was in a close room discussion with healthcare facility. Some doctors were there, architects. So those are working in this healthcare business only. So one of them was handling customer care portfolio. So he said nobody complained about the air quality. So my question was, are they aware of air quality?
Exactly.
So then there was a silence. See, people don't question because they can't see air.
Correct. They don't
So when-
know also because आज खाने को लेके फिर भी complaints आ जाती हैं कि
Exactly.
मेरी डाइट में मुझे ये बोला गया था लेकिन हॉस्पिटल से मुझे ये खाना आपने भेज दिया.
Be it khana ho ya anything which is visible, which we
Yeah.
know that what is to be followed, but none of the hospital, ideal situation would be that hospital display the IAQ
Air
levels
quality,
in different areas, okay, isolation ward and OPDs, and
That should be ideal.
so if those are visible or it is available in real time basis on the internet, it will be much easier for a patient to select the hospital.
So why is this not being क्यों नहीं ऐसा बोला जा रहा है कि करना चाहिए ये?
Actually, it should
Mandatory?
happen and it will help the hospitals itself.
Yeah.
Means we are in this business being, from American air filters, means our company is 100-year-old company into this business only. And we, more than promoting our products and services, we promote the awareness.
Correct.
Because if people are aware about what they are inhaling, then only they will be able to decide, okay, what is right and what is wrong for them.
Absolutely. Nobody is telling you कि आप ये करो, लेकिन these are the statistics. This is what is happening. Now you make your informed choice.
Exactly.
That's the right way.
And another one very important, observation which we had, you have a very well designed and installed system. It should be operated and maintained in such a way that all design parameters are maintained and it is delivering to that level of requirement. Ultra clean area should be maintained that way only. Unfortunately, healthcare is noble profession, but it is a business now. For years we are saying this. If a hospital has done a business of say 750 crores this year, the next year target would be 825 or 850 crores. 10%, 15% growth. Now the hospital, everything is same in the hospital. How will you increase the turnover? Having more patients, more procedures, whether required or not also sometime.
Yeah, that's
More
debatable.
diagnostics, more tests to be done, more medicines to be used during procedures. Then this is on business side, how to increase the business. Then on cost side, how to reduce the cost.
Right.
Then you will try to reduce the cost by doing something which is, they would not say low cost, but go for a little lower quality. Now again, I'll give you the example of COVID. We had a scenario, especially during the second wave, where people were dying.
Yeah.
We were recommended to use the mask all the time. Some garment industries, garment companies became quite enterprising. They came up with designer masks.
Yeah.
So matching with your shirt,
Outfit
matching
and
with your suit.
Yeah.
And immediately doctor said, there is nothing in this. Please don't use it. You have to have N95.
N95.
So N95, because the size of the virus was very small. Even your surgical mask will not help. So if you have noticed the surgical mask, there is a plastic wire mesh on both the side. And inside there is a very thin foam, 3 to 5 mm thick foam is there. So actually this foam is the filter.
Okay.
Wire mesh is only there to support the filter.
Okay.
So what we were doing during that time, we were using the mask and discarding by the end of the day. We were not washing and reusing those masks. Now, what happens when I was talking to, cutting down the cost? Filters ideally should not be washed. There are filter categories. When I'm saying non-expensive generic filters at primary level, then little higher efficiency filter at secondary level. Then third level is where we are talking of HEPA filter, which are required for special cares or critical care areas, or even in the industries also. So when we are talking of this primary filter, it is like that surgical mask only.
Okay.
There are two wire mesh on two sides and there is a media in between. What happens to save the cost? People wash it. I talked about ISO standard. So ISO standard categorizes the filters based on their efficiency and handling the particle size. Now this primary filter is normally rated as G4. So G4 is the rating for this filter. Once you wash it, the media inside gets broken, the integrity of the filter goes away, and it will allow the particles to pass through it.
Right.
After 3-4 wash, there is nothing left in the filter. It's only the wire mesh on both the side.
Oh.
So that G4 becomes G1 or G0.
Oh.
So there will be tender out, normal process for 1 year or 2 year or 3 year of maintenance contract will be there. The companies which are participating for maintenance job, they'll quote the lowest and they'll wash the filters.
Okay.
Because they have to also earn the
Everybody
profit.
has their own targets.
They have to earn profit out of that also.
Correct.
Now, people don't see the far-reaching damages which it causes. When these particles pass through primary and secondary filters, which we washed in, there is hardly any filtration remaining, then it goes through the most expensive part of a air conditioning system, which is the cooling coil. Cooling coil is normally wet because the condensation happens. Dust particles will go and settle on this. It will make a layer on that. So it does two things. One is that the cooling efficiency of the coil will go down. Second is it will create a higher resistance on the path of the airflow.
Okay.
So your fan which is there, which is circulating the air, will have to put more force to deliver the same amount of the air. So by saving some small amount, we are making the air conditioning plant to work more or work harder. Fan is working
still
harder.
Not giving the same efficiency. Which
still not giving the same efficiency. Plus, the worst is if this contaminant is traveling to the area where the patient is being treated, or the doctors and other health workers are there, they are also exposed to all that. So by saving this, we are not looking at the bigger picture. We are long term.
ये चीज को कौन चेक करता है? ये होती है ये चीजें चेक कि कितना मेंटेनेंस में कितना अच्छे से मेंटेन उसको, because okay fine, you installed the best system in place, but are you really maintaining it, changing it, upgrading it as and when required?
I doubt.
And what about areas, common areas? चलो hospitals एक चीज हो गई. What about areas like offices and other common areas where people use air conditioners, gym for example? इस तरह की जगहों में किस तरह से maintain किया जाता है इन चीजों को?
If you talk of IAQ, it is not maintained. Normally we have approached, means we have a sensor where we can real time we can show the air quality.
Really?
And we have shown the people that you are sitting in a,
infection prone area,
or it is this pollution level is high. Sometimes it is dangerous.
So offices maybe it must be like
you go to any exhibitions, which is indoor exhibitions are there.
Yeah.
See, hundreds of people are there. You don't have place to walk around.
Yeah.
Now, can you imagine the air quality will be, good for the people to be there for 4-5 hours?
What about malls?
Everywhere. All these high density, population areas where people are there indoors, the air quality cannot be good. And we have done it. I was sitting at, the lounge in the airport of International Terminal. I'll not name the airport, but I sent it to the topmost person in the airport I took the screen capture morning 6:30. It was showing polluted, and that was lounge. So imagine the arrival area, imagine the boarding gates.
राइट सो ये जो आप बोल रहे हैं ये जो गाइडलाइंस होती हैं जो ऑर्गेनाइजेशन एन एन what is the name of the organization that
NABH is there.
NABH is
This
there.
is
So
the
NABH जो है जैसे हॉस्पिटल्स को ये गाइडलाइंस दे रहे हैं तो एयरपोर्ट्स मॉल्स ऑफिसेस वगैरह में ये गाइडलाइंस नहीं होती हैं
one is, for all this, the major reason is that lack of awareness of the people. They don't know about what they're breathing. Second is lack of proper regulations in place. Bureau of Indian Standard, which is, they have come out with the standard for air filtration, what should be the air quality in various areas, and it covers all the commercial bodies. So commercial offices, malls, universities, all these comes under commercial establishments.
Okay.
So there are standards. What BIS has done, they have adopted ISO standards. So good enough. Those are established standards already there, and but the challenge is implementation of the standards. There is no mandate to implement those standards. Air conditioners, since it is BIS, they have to use now IS listed filters or IS certified filters only.
Okay.
So we are supplying to like Daikin, our company, parent companies. There we are supplying filters to them. So essentially we have to supply the filters which are BIS certified.
Okay.
But what should be the air quality in the buildings? If that mandate comes, the buildings have to display real time air quality. It will really help.
Yeah.
See,
Tell me
normally
some of the health risks that
I was coming to that only. Normally in the offices, what happens when you are there in the morning, you are fresh, energetic. After lunch, usually, you would have seen people having sort of lethargy, dullness, sometimes giddiness, some irritation, nauseatic feeling, headache. And people feel, no, I'm tired, and then
हाँ मीटिंग
or
अच्छी
I
नहीं रही
have
बॉस ने कुछ बोल दिया
I have had heavy lunch. But what happens when you enter the office in the morning? You have come from outside, you have done some morning exercise, had a morning walk, yoga, gym, and then when you are there in that enclosed space, you are inhaling oxygen, exhaling carbon dioxide. Now this carbon dioxide should be continuously replaced with fresh air which is
Right.
having oxygen.
Right.
There are norms in air conditioning designing that like in office application 10 to 15% of fresh air should be inducted continuously. Gyms should have 25 to 30% of the fresh air because people are doing high intensity exercises. So same way the standards are there for fresh air also.
Okay.
Okay, smoking zones are there, or in restaurants then you have to have more fresh air because people are sitting and smoking also. So that way, so what happens when you are not replacing that carbon dioxide, so people tend to breathe the same carbon dioxide which has gone higher in concentration.
Correct.
And that leads to these symptoms which I just mentioned,
Right.
nauseatic, giddiness, and these are this is called sick building syndrome.
Okay.
Your building is not healthy building. The operators, what they would do to save the energy cost, because when you have to take the fresh air from outside, fresh air which is at say 30-35 degrees in Mumbai or in Delhi NCR will be 45 degrees in summer. That hot air you have to condition, bring it down to the temperature where it should be brought inside the air conditioned space, because air conditioned space you are maintaining at 24 degrees.
Yeah, 23.
So that is a load on the air conditioning system. And when you close the fresh air opening, so the operator is saving and he is making his brownie points by going and telling to his boss that I could save so much on the electricity bill.
Right.
But the damage, long-term damage which is there, the person is not looking at it.
This really confuses me. नाउ आई फील कि अगर मेरा एसी एनवायरनमेंट में बैठी हुई हूँ ऑफिस में या किसी मॉल में मैंने आधा दिन बिता दिया या सिनेमा हॉल में मैं चली गई, तो बाहर की एयर becomes more important for me, and then I'm thinking that बाहर की एयर is also bad. तो इंसान करे तो क्या करे?
Chavi, I challenge people during seminars, even in healthcare seminars. I have challenged people, please go and check your air handlers from where the air is coming. And I challenged to the extent 99% you will not find filters clean and you will not like to sit in the same place
Oh
again.
my God.
I have seen air handlers without filters also.
Wow, that is very shocking
Means
to hear.
putting bed sheet or sari or jute bag also certain cases, because nobody goes inside. Who goes and checks the air handler? Who goes and checks the
Saris
filters?
and bed sheets. My
Yes.
God.
I have seen it with my own eyes.
So I think this is a very important conversation that we are having, and I want to tell my audience that please be aware of the air quality that you are breathing around yourself, not just outdoors, but more
And
importantly indoors.
that to 2,200 gallons per day.
Per day. Wow.
20,000 breaths we are taking every 24
So
hours.
tell me about air purifiers. कि हम at least चलो office में maybe we can, if we are all aware and if we can bring this to the management's notice, maybe something can be done. But at least अपने घर में हम क्या कर सकते हैं?
If we are having, people who are healthy enough, then the standard air purifiers would do some job.
Okay.
We were talking about, cancer patient or the patients who have recovered from such critical illnesses.
Correct.
They need
Even
the
better
same
care,
kind of
right.
environment which is maintained in the hospitals. So when they come back, we can give them those solutions which are customized solutions.
अच्छा.
Unfortunate part is that pollution is also seen as a seasonal subject. When people see haze outside and pollution outside, they run and buy the air purifiers, which is
Yeah.
not the right thing. Pollution is always there. Okay, people may say if we remain so much protected indoors, then we are making ourselves weak.
That's what I was going to come to now. कि मम्मी बोलती थी कि घर का खाना इतना मत खाओ कि बाहर का खाना खाते ही बीमार पड़ जाओ. मतलब हमें लगता है एज अ पेरेंट माई सेल्फ आई फील मेरा बच्चा जितना गिरेगा उतना स्ट्रॉन्ग बनेगा. सो गोइंग बाय दैट लॉजिक, अगर हम अपना एनवायरनमेंट इतना प्रोटेक्ट कर देंगे कि घर में भी एयर प्योरीफायर है, बाहर जा रहे हैं तो एसी एनवायरनमेंट में बैठ रहे हैं, एंड तो ऐसा नहीं होगा कि हम जहाँ ट्रैवल करेंगे बस उसी दिन बीमार हो जाएंगे.
See, inhaling pathogens and inhaling dust particles and pollutants are two different things.
Okay.
Pathogens, there are good bacteria, bad bacteria. It can help, and bad bacteria can build your immunity also.
Okay.
But inhaling the smoke or soot or dust particles will not help you in any way.
In any way. Right, that's like saying रोज एक सिगरेट पियो.
Exactly.
तो आप लंग कैंसर से प्रोटेक्टेड रहोगे.
So I have met some customers like that only.
Really?
One is that they said, what is the ROI if we use good quality filters? I mean, you you want to drink dirty water, you're drinking dirty water, I'm bringing you packaged water and you're saying what is the ROI, why I should buy this bottle? You have to make investment on something which is, the results are not visible.
Yeah.
The better immunity, better health of the people, better productivity of the people.
Correct.
When people are feeling, sick and nauseatic in the office in the second half, they're not delivering the way it should be delivered. So, in fact, this should be the topic of boardroom also.
Yeah.
When we are talking so much of profitability, then this is impacting the profitability when the people are not, feeling healthy at the, end of the day.
But you're right. I mean, people today, because of the kind of world that we are living in, everything is so instant. Gratification is so instant. Results are so instant that ROI भी उनको instant चाहिए.
So when we are saying the standard says the filter should not be washed, so filter should not be washed. There is nothing that, okay, if I buy good quality filter from AAF,
Yeah.
then will there be an ROI? No, there is no ROI.
But there is a
Yes,
long-term ROI, no? There
yes,
is a long-term.
long-term
It's
ROI is
like
there,
it's
which
like
is not
people go to the
visible.
gym and say कि मैं तो एक हफ्ता जाके आया कुछ हुआ ही नहीं.
हाँ,
So you have to look at the long-term
exactly,
ROI.
long-term.
आप
But
एक साल तो जाओ तब आपको difference दिखेगा
but
ना.
when we are
So
looking at the cost consideration, bring the cost
yeah,
down, cost of operation,
instant
maintenance,
ROI.
yes.
वहाँ
So
आपको
then
instant
those
दिख रहा है.
things get diluted. Even I was mentioning that I went to the people who are in branded hospitals, hotels,
जी.
hospitality industry, and the chief engineers and directors. Some of them I met. One of them said, यार मैं तो दिन की 10-12 सिगरेट पीता हूँ, मुझे तो कुछ नहीं होता. I said, sir, I can only wish you good luck. What you are saying कुछ नहीं होता today, at the later age of part of your age, definitely you will face all these things.
Yeah. That's actually very ignorant of somebody
Exactly.
to remark like that. In fact, the statistics that I was going through before I was talking to you also said that 6% of people who die of lung cancer don't die because of smoking or AQI. They die because of indoor air quality.
Exactly.
So if you can get lung cancer and die from it, and the statistics did not talk about people who survive it. There must be so many who got it
So
but survived.
the numbers which you spoke about are quite conservative.
Yeah. Okay.
It is 7.9 million deaths in 2023
7.9 million deaths because of indoor air quality.
because of pollution.
Because of
So
pollution.
indoor, outdoor. Dementia death due to air pollution in 2023 was 600,000. 6 lakh people died dementia death because of air pollution.
Wow.
So what I said, the particles which are invisible, which we are continuously inhaling,
Yeah.
reaches to our bloodstream, and blood is circulating
Everywhere.
in
I
the
mean, it's
entire
not just
body.
it's not what you're saying, it's not just respiratory. It's going to your brain.
Brain also. So your kidney, liver, brain, heart, everywhere this blood is there. So every cell of your body is getting impacted because of the pollution, and we don't realize it.
We don't realize it because we can't see it. And because we are looking
And
at
sometimes
ROI.
happens a person, a saint like person, बाहर नहीं खाना है, तला हुआ नहीं खाना है, और ना सिगरेट पी, ना कभी तंबाकू खाया, ना अल्कोहल कंज्यूम किया, and then this person gets into all this thing and we feel sorry, yaar, this guy was so good and then how
what
come so?
happened? But this is a silent
Exactly,
killer. You don't even
exactly.
realize what you're doing. So I think thank you so much for coming and spreading this awareness for us, because genuinely telling you, before I got the call from your team, I had no idea what indoor air quality is. हमें genuinely लगता है, मुझसे अभी recently किसी ने पूछा कि आपको safe कहाँ feel होता है? What is safe for you? And I said home is safe for me. And for most people, home is safe for me. हम लोग बाहर जाते हैं, ऑफिस जाते हैं, काम करते हैं, we are constantly competing, we are, running against our capability and meeting deadlines. But when we reach home, we feel safe. And for me to know that I'm not safe in my own house because of the air that I'm breathing, I'm very careful about what I eat. I measure my food and eat. I drink my water nicely. I don't drink caffeine, no tea, no alcohol, no smoking. But how do I control this? This is really an eye-opening opener for me. And मैंने खुद भी कभी, being an educated person who has been a cancer survivor as well, I've never attached enough importance to it or enough importance to an air purifier. And I think it is, right now, I think it's a very simple solution to a lot of big problems today that we are facing. कुछ नहीं करना है यार, सिर्फ वो एक इंस्टॉल कर दो, आप थोड़ा उसको मेंटेन कर लो.
You have to be aware.
Only you can do it only if you're aware.
If you look at India, it is growing medical tourism hub.
Yeah.
It is one of the fastest growing industry. Currently, it is to the tune of $20 billion and expected to reach to $65 billion in next 10 years.
Okay.
In oncology itself, the growth is 17% year over year.
Wow.
So if we look at these, projections, the future is there. There is a potential in this, if we say industry, though it should not be treated as an industry, but unfortunately this is industry. But then when this is an industry which is expanding so fast. So many hospitals are coming with modern facilities. It is imperative that hospitals take due care of IAQs. The ideal situation would be that they display the indoor air quality in different areas of hospital, different sections of their hospital, to have that confidence. Why this medical tourism is, growing fast? Because we have low cost procedure at high quality. Accessibility of doctors is very good. In USA, Europe, people wait for 6 months, a year sometime to get the appointment. We just walk in and we get the treatment. So that's the privilege we have in India. So to take it to the next level, to get that confidence of the patients and families, even the health workers also getting exposed to that environment if it is not sanitized or hygienic. So we have to adopt those right practices which ensures that yes, we are in the right direction. And not only healthcare, everywhere this should be there. When I was approaching these branded hotels, hospitality industry, I said, you display this in today's time. Everybody is, talking about air pollution. You display your air quality which you are maintaining inside.
Correct.
It can be one of your USP.
Exactly.
For us, we are into filter manufacturing, but I always give message to our sales team: don't go and sell filters. There are hundreds of companies which are, producing filters. Don't be in that rat race. Let the user understand there is a problem, and then we have a solution for him. So at AF, we are always trying to, promote the awareness rather than promoting products and services.
It's the most important.
So that sanity is required in this business. The regulations have to be mandate. Then only we can, improve this situation. I'm not saying that we need to close down everything and then make the homes airtight, but one step definitely will help, having a right kind of air purifiers and maintaining. So we'll at least come out of this situation and think of, kids when during their formation years, when their body is growing up, if they are exposed to the pollution,
it will have long-term
impact.
The
The senior citizens who are having a weak body, the patients, so they are the ones who are most impacted by the pollution, any kind of pollution.
और दूसरी चीज़ मैं ये भी बोलना चाहती हूँ सबको कि प्लीज़ वो एक एयर प्योरीफायर का जो एयर क्वालिटी का जो मेजर करने का जो भी है ना सिस्टम, वो सबके पास होना चाहिए. और आप जहाँ जा रहे हो एक बार मेजर करके ना उसको स्टोरी ज़रूर डालो ताकि मोर एंड मोर पीपल कैन फाइंड आउट अबाउट
That can
what
happen
bad
really.
air quality
Yes.
we are breathing.
No, this is
I'll
what
do it for sure.
It is our right to have clean air,
Yeah,
to breathe.
correct.
So let us reclaim our right. We have been ignoring it for long.
And the most important message is the same, that
message.
please be aware. ऐसे आंखें बंद करके जैसे होते ना फ्रॉग इन वेल, वो मेंटालिटी नहीं होनी चाहिए हमारी. घर हमारा सेफ है, लेकिन वो सेफ रहे वो इंश्योर करना भी हमारी रिस्पॉन्सिबिलिटी होती है. सो लेट्स नॉट फॉरगेट दैट रिस्पॉन्सिबिलिटी दैट वी हैव एल्डर्स इन द हाउस, वी हैव सिक पीपल इन द हाउस, वी हैव चिल्ड्रन इन द हाउस, एंड giving them good air to breathe is our responsibility. So let's do whatever we can. I'll put down all the details that I can in the description if you want to check it out, if you want to get something customized, या और information आपको चाहिए तो आप नीचे जो मैं links डालूंगी description में, please check कीजिए, उस पर click कीजिए, and please let me know what are your thoughts after listening to this conversation. I don't think I'll get good sleep tonight because I'm really, this is really, really, really shocking for me to hear. And thank you so much for sharing that with us, Shailesh. Thank you so much for making an effort to come here and talk to all of us. I really appreciate it. I hope you had a good time.
Rather, I would thank Chhavi for giving this opportunity to, spread this message to a larger mass through your channel.
Thank you.
So
I feel
it's
really honored
a
that
real good opportunity.
I'm honored that I have the ability to do that. So I hope you guys enjoyed this conversation as well. Please put your thoughts down in the comments below. And this is both of us signing out. Love and peace from us to you.